A $15 million investment to drive Singapore's push in harnessing emerging technologies like AI for social good, as it looks to become a global leader in the space. Speaking at an inaugural conference for sector partners, Social and Family Development Minister Masagos Zulkifli says the government will lead efforts to bridge innovation with frontline expertise.
Singapore is well positioned to seize these moments. We are small enough to move fast and connected enough to share. The partners needed to make it happen are already in this room. Technology companies who can co-develop scalable solutions, research institutions, and who can help us validate and refine them, and SSAs with invaluable frontline knowledge. Together, we have everything we need to lead. But this means, though, that we must move fast and more intentionally.
One focus area for using tech is strengthening prevention. The ministry wants to make better use of data to identify those at risk and reach out with support earlier. But Mr. Masagos says building such capabilities will require even stronger partnerships, some beyond Singapore's shores. The government plans to deepen international engagements, learning from successful ideas overseas and adapting them for local needs.
Good ideas know no borders. When another country finds a better way to support its most vulnerable, we want to learn it, adapt it, and bring it home. Singapore has always believed in learning from the best wherever they are.
Mr. Masagos adds that AI must be deployed responsibly. Rather than replacing frontline professionals, the technology is expected to take on routine administrative work, allowing workers more time for their core work with families. He adds that any new tools must remain human-centered, with professional oversight and safeguards. To kickstart this next bound of transformation, the ministry signed 2 new partnerships with ST Engineering and NCS to develop pilot emerging technologies for the social service sector.
In the case of the social care professionals, we are looking at how to provide information to their needs. For example, they may be handling a few cases at the same time, where is the status of their cases and where the intervention that is needed, so that they can also offer the advice to the families and beneficiary in a timely manner. That will greatly reduce the workload for the social care professionals themselves.
Artificial intelligence is gaining ground across Singapore's social service sector, from facial recognition for medication checks to platforms supporting caseworkers. A new round of funding is expected to help agencies expand these efforts and scale AI adoption across the sector. Chloe Teo finds out more.
It takes just a few seconds, but this AI-powered facial recognition system plays an important role in ensuring that the right medication is dispensed to the right patient every day at this adult disability home. It's one of the many innovations that have been developed and trialled by social service agency AWA. They range from assistive devices that help residents live more independently to AI-powered tools that help frontline staff deliver safer and more efficient care. Yet, the core of every innovation is driven by the same guiding philosophy, a problem that needs solving.
For example, we will say like, our client have this issue. Yeah, like one of our clients would like to actually do desktop activities. And then we are thinking, how can we actually help the client be more independent? Yeah, so we actually kind of like from there come up with a solution. Yeah, so it's not so much on which tech we need to use. We don't go on the idea first. We go on the problem first.
But this process isn't always straightforward. Beyond funding, the agency says finding the right partners remains one of its biggest challenges.
I think we always find the resources and also the network, because we only know like certain people, but then if let's say the network is bigger and we have more funds, then of course like we can reach out to, like for example, MDA very good with AI, then we can actually like partner together and like do some solution together.
Elsewhere, Care Corner is using the same drive for innovation to tackle a different challenge. An AI-powered transcription tool has helped its staff cut down the time spent on administrative tasks by at least half.
Our social workers, they are coming back to tell us that while case numbers may not see big increases, but the kinds of cases that they are working with have become a lot more complex. So the time taken to support the family, help them through that difficult period, actually now requires actually a lot more effort. And very seldom can you just find one solution to be able to address the needs of the family.
It's now trialling an AI-enabled case management platform designed to surface gaps in assessments and strengthen case planning. It says the government's latest moves could help accelerate efforts like these.
I think it's important that MSF makes very concrete investment in innovation because as an agency, it is a very important signal that this is an important investment that we need to make. We see the value in really coming together and working together as opposed to working individually, because I think some of these solutions really does require that partnership.
The social service agency also hopes to channel some of the new funding into developing its workforce, so staff are better equipped to harness emerging technologies.